I would like to call the next speaker of the session, Professor Norihito Wada from Japan. He's assistant professor in the Department of Surgery in Tokyo, Kyo University.
Thank you, Mr. Chairman. Distinguished guests, ladies and gentlemen, it is my great honor to have an opportunity to present here at the 10th International Congress of IAS meeting. Today, I'd like to talk about the development of expansion of the ambulatory surgery in Japan. First, I'd like to overview Japan's status in healthcare. This slide shows that the life expectancy is longest, although the health expenditure is average. The cost effectiveness of our healthcare system may be feasible. Interestingly, Japanese people don't feel being in good health. Only 33% feel they are in good health. On the other hand, the people in the United States may be optimistic. In Japan, the number of practicing doctors is not high and below average. Human resources are limited, although the demand for healthcare is increasing. Japanese doctors are very busy. As shown here, the number of patients consultations are high. This is partly because in Japan, the patients can go to any hospital freely without a referral. As to the facilities, hospital is well equipped. The number of MRI and CT scan is extraordinarily high. The number of hospital beds is also high. 60% of the beds is for the acute care. But the hospital discharge is low. Therefore, the average length of hospital stay is longest, although the length is decreasing recently. As you can see in this slide, the 5-year survival of the colorectal cancer is high. The quality of surgery is also high, and doctors can use novel molecular targeting agents for every advanced cancer patient. Of course, the health insurance coverage is 100%. Our healthcare expenditure is below average. The percent of elderly Japanese is 23% today, and it will go to 30% in 2025, and then 40% in 2055. The aging of the society would put the tremendous strain on the economics of the healthcare system. Healthcare system in Japan is a universal healthcare insurance system. Anyone can go to any facility without a referral. Fees are set by a government committee. Patient usually pays 30% of overall cost, with some differences by the age group. Historically, fee-for-service system was used. I'd like to explain our DRG system. Since 2003, a new reimbursement system called DPC, PDPS, has been implemented. Moreover, a fixed reimbursement for a specific patient condition was established, which intended to drive the efficiency in treatment. The system was studied with 82 university and national hospitals. The system was, in 2012, the hospital that have adopted DPC is total 1,500 and account for 500,000 beds, over half of the general hospital acute care beds. This slide shows the common day surgery procedures in Japan. In the general surgery, of course, inguinal hernia and hemorrhoids is very common problem in the day surgery basis. And also, cardiac surgery is a major target of the day surgery in Japan. In the orthopedics, the arthroscopic surgery is also performed in day surgery. And in gynecology, the cervical colonization. And in the cardiology, PTCA. And in the gastroenterology, the endoscopic mucosal resection for the gastrointestinal malignancies also performed. But laparoscopic surgery, such as cholecystectomy, is not so common in Japan now. We should change the social system to increase the surgery for the laparoscopic surgery. Here, I'd like to introduce the Japan Short Stay Surgery Association. JSSA is the only academic group for ambulatory surgery in Japan. It was established in 2004. The president is the Dr. Tomonari Shigyo, who is a hernia surgeon working at a private clinic. JSSA has a certification system for the day surgery coordinator. We got a full membership from IAAS this year. So we are newcomer, however, I feel that our mission is to expand the number and the category of the member of JSSA, to create the clinical evidence of the merit and feasibility of ambulatory surgery in Japan, and to advocate to increase the incentive of the ambulatory surgery in Japan, and to give the sufficient information to the patient. Thank you for your attention.
Thank you, Professor Norihito.